Hi, everybody. Welcome to another Chats with Children. I hope you're safe and well. Today, I'm delighted to be joined by Claire Dacombe, who is the new VP for APAC region for Astrea Bioseparations. And today, we're going to learn about some of the trends within the biopharma sector within the APAC region. So, Claire, lovely to see you. How are you?
Hi, I'm very good, thanks. Thanks for having me.
Well, it's obviously, so where are you actually calling in from this evening, your time, and morning, my
Yeah.
time?
So I'm based in Singapore at the moment.
Fantastic. And what's the weather like? It's a bit cloudy here in the UK. It was sunny this morning, but it's starting to get a bit cloudy right now.
Yeah, no, we're in a storm at the moment, which is very common for this region. We tend to get most days some kind of a storm. So as per the norm, it's stormy right now. So hopefully we won't get too much disturbance from thunder or lightning.
All right, cool. All right, look, now I know you're based in the APAC region, but before we start talking about some of the trends within the region, I think it'll be really helpful for viewers to just get a bit of understanding on your own background and also about Astrea Bioseparations if you've not heard of the company before.
Sure, of course. So I came from a technical background. So I did my PhD in biochemistry and genetics at the University of Bristol in the UK. And following that, I went into kind of a technical support global application role. But because I was based out of the UK, I was focused mainly on the European market. And it was within the kind of bioproduction, cell line development, drug discovery part of the workflow. 10 years ago, I relocated to Singapore. So obviously once in Singapore, I looked after the Asia Pacific market, including China, initially as a kind of technical, so as an applications, and then I moved into kind of more the commercial side of things. So working with the region there. And my previous company, I was with Horizon Discovery. So again, in the bioproduction space, much more upstream, so drug discovery, cell line development. And we set up the APAC region to support the customers here. So setting up a team in Japan, the office in China, and then throughout this region, some more direct support. And then about 3 months ago, I joined Astrea Bioseparations to head up the Asia Pacific region again. And really, as this market is kind of growing very quickly in this area, we want to be able to offer the support locally to our clients as that happens. So for those that are not familiar with Astrea Bioseparations, so it's used to be called Prometic Bioseparations, so that may be a company name that people are aware of. But a couple of years ago, it was acquired by gammabiosciences, so we're part of that portfolio of companies. And we're focused really on the downstream processing. So we have a range of adsorbents for the purification or for the cleaning of products once they're manufactured. So these are resins, for things like affinity purification. And quite unique to Astrea is we actually have the license for Avacta's Afama library. So as well as having ready to go solutions, we can really custom develop ligands for novel products for our customers, and then go all the way through into developing an adsorbent and scaling that up to manufacturing. So, we have the ready to go solutions, and then we have the ability to custom make for our, for different needs.
Brilliant. Okay, so I think it's interesting talking to you, because you've obviously worked in both upstream and downstream and worked in Europe and Asia. So my first question is really, what similarities are there with the APAC region and the rest of the world, first of all? And then let's look at what some of the differences are from your experiences there.
Yeah, so I would say from the trends, they do follow a similar trend to what we see in the rest of the world, but certainly it's been a little bit delayed in Asia. I mean, Asia as a whole, you kind of have to break it up into different countries.
Sure.
China, Japan, they're probably a little bit more advanced, South Korea. Whereas you take some of the smaller countries or smaller as far as biopharma are concerned, like Indonesia, Vietnam, Thailand, these are quite significantly behind that same trend. So they do follow the same trend in that, for instance, we've seen the transition from R&D from small molecules into the biologics, but it's been delayed by, a few years versus what you might see in the rest of the world. But interestingly, a lot of people that kind of worked from Asia that went and transitioned into, say, the US, into UK, into Europe, many of them have come back into this region now. So what we're seeing is that the delay between kind of what's being developed here and what you're seeing in the rest of the world isn't so prevalent.
Right.
And certainly when we talk about new technology, so you think something like cell and gene therapy, I'm seeing that coming up, particularly in countries like China, South Korea, Taiwan, these are growing in the same trajectory as we see in the rest of the world, which is quite interesting. It means that, you know, from our point of view, the issues that my customers in this territory are seeing are similar to what we're handling in the rest of the world. So, you know, when you talk about cell and gene therapy from a process point of view, there's a challenge, which is, you know, what you're trying to purify. So whether it be a virus, whether it be, you know, plasmid DNA, exosomes, these are large. And so when you're talking about a standard resin, which is usually, you know, a bead, there's a pause in that bead that the product needs to go through in order to be able to bind and for us to help our customers purify it. Now, if there's something large, it can't get through that bead. So it just sort of has access to the outside of that bead. And we can't make the pores bigger because as you fill a column, the weight will actually compress that column down and those beads would collapse. So we're looking at, you know, novel ways to be able to support the purification of those kind of products. And actually we have, under the gammabiosciences, we have another company called nanopareil, and we are very closely linked with them, and they have nanofiber technology. So we have the expertise at developing the ligands and then binding those ligands to the matrix, and they have this really very novel nanofiber material, which again can have larger pores. It allows us to work with things like viruses. So in that respect, the same challenges are across the world. So, you know, we can all tackle that together. And I don't see much of a variation when you look at rest of the world versus Asia Pacific in that respect.
Right. Okay. So similar question though, but maybe looking the other side. So what are the unique challenges you can see then that pharma and biopharma companies are facing within the APAC region?
Yeah, so I mean, there definitely are certain unique challenges, particularly when you break it up into different countries. And one of those is obviously some of these countries have much lower GDP. So the funding available, the accessibility of those treatments just isn't there because they can't access them for the cost barrier. So one of the things that we see a lot more here, and it's definitely driving some of the biopharma market trends here, is the biosimilar market.
Right.
So this is, you know, there's a lot of that in India, in China. These are countries that are now looking to develop cost-effective biosimilars, which they can then provide to the domestic market.
Right. And how do you see then customers, or how are customers looking to overcome those particular challenges?
Well, the challenges of kind of the financial side of things is really around, having the technology and the tools in place to improve the processes. So certainly from the biosimilar market or any biologics market that's here, where we try and support and where we can help is to improve the process downstream so that the yield, the product they're getting back when they're cleaning it essentially, is as high as it can be. We're maximizing that yield. So with Astrea Bioseparations, we obviously have the tools to do that with our off-the-shelf adsorbents, but also we can, as I said, we can custom make things that are really optimized to allow them to do that. So that's an area. And the clean, impurities, removing impurities is a challenge. So we work very closely with our customers to offer solutions to do that, so that if they have a sample that goes through a certain process, they don't then lose the yield. They can actually recover most of it back and still remove kind of the junk from what they have that they don't want. So I think that's an area that's a focus to be able to make what they have more cost effective.
Right. And looking, as you said, all the countries are very different and they're all at different stages. And obviously we always hear about what's happening in China, Japan, Korea, India. But have you seen any particular trend for any of those sort of stand out for you within those big countries? But also, what countries do you see are up and coming in terms of biopharma manufacturing and investment, if you like, in pharma and so on?
Yeah. So that's an interesting kind of question to pose. And I would say when you look at China, India, these are big biopharma markets already. Predominantly, there's a lot of research, there's a lot of investment gone into the biosimilars, as I mentioned, but interestingly, they are moving outside the domestic market. So at the beginning, they were really focused on providing solutions to the domestic market. We're now seeing them moving out into the rest of the world, getting their FDA approvals, giving that product accessibility globally, which is great because they're much more affordable to patients and, you know, to healthcare systems. When it comes to kind of the other regions, you know, I see countries like Indonesia, they are starting to pick up. You know, when I first moved here 10 years ago, there was almost no biopharma there. Now we see several companies coming up. Some of the areas are things like insulin, for instance. So in this part of the world, diabetes is on a rapid increase because of the speed at which diet has changed here. And insulin is very expensive, right, to get hold of and to provide to patients. So now there are many customers here that are working on insulin analogs. So other ways to supply the market locally with insulin, which is critical for, you know, for the healthcare system. And we, you know, I'm aware of that because we provide an affinity-based solution for them to do the purification of, you know, the insulin analogs from their feedstock. So yeah, it's an area that I'm seeing growth into, you know, Indonesia, Vietnam. They're starting to come up with some of the biopharma as well. So I think there'll be ones to watch.
Right. Okay. Well, one question I just realized I didn't ask you, and I had down ready to ask you, was about the pandemic, because obviously the pandemic has had a massive impact on the pharma sector, obviously globally as well, on everybody individually. And obviously we've seen how Europe and North America have reacted, first of all, to the pandemic, you know, through governments and regulation and what they've been doing to stop it, but also how it's impacted the pharma industry here. So Asia obviously has dealt with the pandemic in a very different way to Europe and North America when it first came out. So how has that impacted the pharma sector within the APAC region?
Yeah, I mean, I think, like you say, there has been a big difference in the response. So from Asia, the response was kind of immediate and there was some severe lockdowns, whereas, you know, in the rest of the world, maybe not, a bit lumping it all together, but, you know, if you look at the UK, for instance, from my point of view, that happened a bit slower, but was kind of over a longer period versus some of the countries here. So definitely it's given some different challenges. And I think the pharma sector, along with every sector in the world, has been impacted by this pandemic. But I think you can kind of split it into two sections. So from the short term, it's been a challenge, of course, because there's resource issues. And that's not just people what could, you know, was an issue because people were getting quarantined or stay-at-home notices, and so they weren't able to be into, you know, in the labs, in the manufacturing. But on the other side is also the raw materials. So, you know, there are so many raw materials that go into what's needed to manufacture biologics. If you don't have those raw materials, then of course we can't then make the product they need. And so from our industry, an interesting one's been sapphirose. So sapphirose is predominantly what most resins are made from. The beads are actually manufactured from sapphirose, and there's just been a global shortage of sapphirose. So there's a long-term delay in getting those products. We've been in a fortunate position because we make our own beads, we make our own resin, which is from agarose. So we've actually been able to help our customers here with that concern by offering them a security of supply because we work from a different raw material. So that's just one example of where, you know, there's been challenges that have come about. And then, of course, there's the funding side of it. All of the funding we've seen has been kind of redirected into COVID vaccines and COVID treatments, which absolutely, of course, the right thing to do. You know, we need to be able to recover from this pandemic, but it leaves a kind of gap where there would have funding before, you know, and so then there's challenges when you go into like oncology and the other indications, other therapeutic areas that are now seeing less funding at the moment. However, on the long term, I think that it can be quite positive, certainly for visibility of the biopharma industry. You know, governments, public in general are just much more aware of how important that industry is. You know, without a lot of the research that's happened for many, many years before, we wouldn't have been able to release these vaccines so quickly, have these therapies. So this just shows you the value there is in investing in the biopharma industry and keeping that, you know, running as it should be. So I think that should be a positive fallout in the long run.
Fantastic. Well, thank you for that. So finally, where can people get more information on Astrea and the solutions that you offer?
Yep, so I would definitely head to our website. So our website is astreabioseparations.com. And I touched on the kind of collaboration that we are with our sister company, nanopareil. So this is the company that makes the nanofibers, and they're a really exciting technology. So you can also access their website, which is nanopareil.com. And actually, in fact, gammabiosciences is the parent, company for all of these, and they have a lot of focus on cell and gene therapy. So that's also a pretty interesting website to access those different technologies. So I think they're probably a good starting point.
Fantastic. All right. Well, look, you don't have to take those notes down, people, to write them down rapidly or get them spelled out. I'll put the links above the video so you don't have to worry about that. And also, if you have any questions for Claire, then you can actually leave them below the video as comments, and Claire, I'm sure, will be happy to answer any question you've got. So Claire, all the stuff when you say is thank you very much for taking time out in your evening to talk to me about what's happening in the APAC region. It's lovely to see you. And I understand you're coming over to the UK tomorrow.
I am. I'm finally getting to get back home for the first time in 2 years. So I'm very much looking forward to that.
Well, yeah, well, I don't want to scare you, but no one's got any petrol at the moment, so just be aware of that.
I did see that. So I was like, well, that timing's really not ideal.
So hopefully you'll be able to get home all right from the airport. All well. So we'll have a lovely flight. It's lovely to see you. And good luck with developing the offices in the APAC region. I'm sure you'll have fantastic success. So thank you very much for taking time out to talk to me today.
Thank you very much. Bye.
And thank you, viewers, for watching. I hope you found that interesting. I certainly did, learning more about what's going on within the APAC region. If you've got any questions, as I said, for Claire, please leave them below the video. She'll be only too happy to answer them. And check out the links above the video for Astrea, Gamma, and nanopareil. God, I just remembered that off the top of my head, just that one. So enjoy that. Until next time, as always, stay well and stay safe. Bye-bye.